Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Salman Waqar. I'm the General Secretary of the British Islamic Medical Association, and this is just a short update to really try and set the scene for what has happened in the last week and what the next week may be bringing. And I just wanted to start with a graph that's been taken of the number of cases and the number of deaths that have been reported in the UK in comparison with other countries. And it seems to be that our cases are continuing to rise, our deaths are also continuing to rise. And it's not quite clear as to whether or not we have reached the peak yet, unfortunately. The initial estimation was that this weekend would see the worst and things would get better, but that has, to the best of our knowledge, been revised to next week. So that means that we need to keep the pressure on. What's more interesting is that the disease burden of COVID has actually switched from Asia to to Europe and North Africa. As you can see, that the US now accounts for a third of the deaths across the world, and the UK is now reporting more deaths than Italy or Spain put together. And we know how difficult it was for them when we were listening to the news stories about what was going on there just a few weeks ago. All of this really reinforces the message that even though the weather may be glorious today for many of us, that it is entirely inappropriate for people to be going out, meeting friends, meeting other people, congregating, despite having good weather, because if that happens, the deaths and the cases will continue to rise. And this is particularly important as we enter into the holy month of Ramadan, when there may be a temptation to perhaps maybe just go out and visit relatives, perhaps maybe just go and sit with someone for a few minutes. But really, that is all that's needed to potentiate the spread of the virus. So it's incredibly important that people take the advice to stay at home seriously. It doesn't matter if it's for 5 minutes or 50 minutes. Contact with people will increase the spread of the virus and unfortunately will cause more people to pass away from it. So until we get further advice from the government and from experts about when we can ease social distancing and ease our isolation, we must continue to stay the course. The other important thing that's been noted actually is as a result of this, the situation with COVID, that unfortunately people who have other conditions which are still happening, people are still getting infections of their appendix, people are still having heart attacks, people are still having strokes, etc. People are scared, people are unsure, people are delaying the presentation to speak to a healthcare professional, to go to A&E, to speak to GP or to 111. And unfortunately, there have been a small number of cases where sadly children have become very unwell and have even died because their caregivers delayed in seeking presentation. So I just wanted to really reinforce the importance of seeking medical attention. And if you are unable to get through to someone on the phone, to take your loved ones, particularly your children, to A&E to seek timely medical attention. It's worth noting that children very rarely become unwell with coronavirus. So if a child is very unwell, it's very unlikely that it's something other than coronavirus. And hospital A&Es are set up to receive people, and they will see them in a timely manner because across the country, A&E attendances have come down. So A&Es will see you quickly. But of course, if you don't have a serious illness, do whatever you can to stay at home and self-care, speak to 111 or speak to your GP. Now, the main issue that's on a lot of people's mind is around Ramadan and COVID-19, the coronavirus. And so what we've done over the last week is a few things. Firstly, we've issued this guidance in association with the Muslim Network at the Department of Health and Social Care, which is mainly for managers and employers. So if any of you do know people who are working in the NHS, please do signpost them to this advice, which is essentially outlining the importance of Ramadan to Muslim staff members and how managers can help support them, particularly with praying at work and offering flexibility in their shifts, in particularly so in light of the COVID-19 pressures. The most the biggest piece of work that we've been undertaking are these rapid evidence reviews on Ramadan and safety, which essentially is an attempt to synthesize the existing evidence on what we know about fasting in Ramadan with certain long-term conditions, and trying to present that in a way that scholars, patients, and the public can understand. There's been a great deal of work done in this area on diabetes, and this table on the screen here just outlines the type of information that we know about diabetes, about which types of patients should be advised to not fast, which types of patients could consider fasting. And of course, if anyone does have any questions, it's very difficult to answer specifically without knowing the medical record and the medical history. But in essence, fasting remains an individualized decision. It's individualized to the person's ability to fast and to tolerate the fast, particularly in these summer months and in light of their occupation and other commitments. And it's also based on the medical advice that we would give you based on what conditions that you may have. At the moment, there doesn't seem to be any evidence that suggests that fasting would increase your risk of developing, catching, or deteriorating with COVID-19. Of course, if you are unwell, there is dispensation given to anyone to break their fast. But from what we know, you're not more likely to become ill in this Ramadan with COVID-19 if you were able to tolerate the fast safely in previous years. We understand there's a lot of unknown, there's a lot of anxiety, and particularly because of disruption to services, some patients may find that if they were previously able to fast in Ramadan only after having blood tests done or having spoken to their GPs or their specialists or specialist nurses, they may find that this is difficult to do in light of the burden that is placed on the service. And so the advice there really would be to consider not fasting until this is able to be done safely. What we've done, and this is available on our website, britishima.org/COVID, is release two papers. These are the first two papers in a series that we will be releasing around the evidence on these conditions, as I mentioned. The first one here is around occupational health. So this is for key workers who may be working long shifts, maybe wearing PPE, maybe performing highly complex tasks. And this summarizes the evidence around that. The other paper there is around immunity and infection risk, which looks at some of the evidence around what Ramadan fasting does to the body in terms of its immune system and the likelihood of you developing infections. And you're, of course, free to read them and to share them, particularly with employers if you feel that you're finding it difficult to have flexible arrangements. One of the other things we've also been aware of is the fact that visitation policies in hospital trusts are becoming tighter. And this is from two angles. One, patients are finding it difficult to visit their loved ones who are in hospital and very sick. And on the other hand, staff members are reporting that some patients are becoming more angry and becoming more combative and unfortunately obstructing the ability of very busy and very overstretched clinical, administrative, and even chaplain services from carrying out their jobs on the ward. And what this document's basically trying to do is to plead to trusts and to patients that this is a very, very challenging situation. And there may be cases where, unfortunately, individuals may not be allowed to visit their loved ones, particularly in critical care, simply due to a lack of staff, due to a lack of appropriate PPE, to prevent infection being passed back onto the family members as they go home, or infection being introduced onto the ward where there are some seriously sick people there. What we're trying to do is to explore the role of chaplains, and I know they're doing a fantastic job, but we are encouraging trusts to really work with them, and particularly patients need to realize that chaplain services are available in trusts to be with loved ones, particularly at the end of life if people aren't able to visit. And it's important that the community as a whole is aware that forward planning is vital in overcoming these challenges. If any of you do have a relative who is frail, who is elderly, it's important that you discuss the wishes with them beforehand, particularly plans about resuscitation, but also plans about what might happen if no one is able to visit. It's also important that the family nominate one individual, ideally who is able to speak good English, to communicate with the hospital staff, because this can also cause problems not only in terms of training and PPE, but also in terms of mixed messages. We're also in the process of releasing some videos which help explain the issues around the end of life, aimed for the Muslim community, trying to dispel some myths and explain that the way palliative care works. And these, inshallah, will be coming out very shortly. So that's our presentation. We can be contacted at covid@britishima.org. As I mentioned, the resources are hosted at britishima.org/COVID, and we're also available on our social media, and those are our handles there. That's the presentation from us. Zainab, I'll hand back over to you if there are any questions.
Thank you so much, Salman. We have a number of questions in for you, which I'll get started with. The first question was, and I believe you briefly touched on this at the start of your presentation, so maybe it's just worth reiterating. The question was, are we exempt from fasting on the grounds that a dry throat increases your risk to respiratory infection from COVID-19, even for otherwise healthy people?
So in otherwise healthy people who would normally fast in Ramadan without any problems, there is no evidence to suggest that Ramadan increases your infection risk. It's important to caveat all of this with that there is no data. There are no data for fasting and COVID, because we wouldn't know, and there's lots of unknowns about COVID. But from what we know about other viruses, including other coronaviruses, there doesn't seem to be an increased risk. It's also important to mention and for people to consider, as a result of social distancing, isolation, and for those seriously vulnerable, shielding, people will be staying indoors more, so they're less likely to pick up infections. They're going to be less likely to, they're going to be resting more, and they're also not going to be spending as much energy. So there may potentially even be some protective benefits as well, on top of what the evidence may suggest in some areas, and it's inconclusive, that fasting may confer some immunity benefits. But I encourage people to look at the document that we've produced. As I said, there is no conclusive evidence one way or the other, but if you're fit and healthy, there is no evidence to suggest that fasting in Ramadan during COVID will put you at increased risk of anything.
Thank you. And then we had another question that asks whether fasting is dangerous if you have any level of symptoms of COVID.
Any what symptoms, sorry, of COVID?
And any of the symptoms of COVID, or any degree of the symptoms of COVID, whether fasting is therefore dangerous.
So again, and the advice is the same as it has been before COVID. If you're unwell, you have dispensation to break your fast. Because of the uncertainty around COVID, that decision for individuals may want to be taken at a slightly, they may want to take that decision at a slightly lower symptom threshold, whereas before, if they may have waited until they had a fever, in this case, if people start to become short of breath first, they may want to consider breaking their fast. Certainly, if someone is very unwell, we all know common sense would dictate that you don't fast. But as I said, the evidence suggests that if you are a well person, there's nothing that would make you more unwell if you decide to fast.
Thank you. And then we've had a few people ask specific questions about their conditions and whether or not that might mean they are able to fast. I know you said that you're not able to comment on individual cases without knowing their history. So would you advise individuals to try and see if they can speak to their GP ahead of Ramadan, or what do you think is best?
Absolutely, and thank you for reminding me. It's really important, especially the fact that we have a few days ahead of us before Ramadan begins, is that people should, if they can, contact their GPs, bearing in mind that GPs are incredibly busy. So that may not be that straightforward to get in touch with them. But if they have got medical conditions and they normally would speak to their GP, please do that. Or if you are uncertain, speak to your GP or pharmacist to get more information. If possible, or where possible rather, try and take voluntary fasts leading up to Ramadan, so you'll understand how your body is coping, particularly with this warm weather that we're having, and particularly if you are a key worker who may be working slightly more strenuously than you would before. So those are important things for you to take. But unfortunately, yes, I'm unable to comment on specific conditions, although I appreciate that is where most of the anxiety lies. Hopefully, when we release our rapid review, there'll be more evidence for individuals and their clinicians to make more informed decisions about moving forward. But it has to be a conversation with your GP.
Thank you. And then we have a couple more questions. How beneficial are homemade masks and visors that people are making and gifting to their local pharmacies?
So the issue of masks is being debated, and the American sources, the CDC, have released guidance suggesting that the American public should consider making masks or even purchasing masks or even making masks. PHE haven't made such suggestions yet, but if people want to make them, there are resources available online as to how they can be made. Effectively, what masks do is prevent you from transmitting your germs to other people, and to a lesser degree, stop germs getting into you. So the effectiveness is difficult to quantify. The most important thing is, if you are wearing a mask, is that you wear it to cover your nose. It must also cover your nose and your chin, but you also must refrain as much as possible from touching your face, because that will then undermine the purpose of having a mask. Unfortunately, I've seen a lot of people in public wearing masks, but constantly touching their nose, constantly scratching their forehead. And that just unfortunately introduces the more likelihood of you transmitting something. But those resources are available online, and unfortunately the conclusive nature of what masks may do is uncertain. What we do know, and is this a confounding factor or is this something else, is that the Eastern societies, so Japan, South Korea, China, Hong Kong, Taiwan, there's a strong culture there in the public of wearing face masks, and their curves are much flatter than what we've seen in Europe and in the West. So could masks be a contributing factor to that? It's very difficult to know. You wouldn't want to imply causation from that, but these are just some things to consider.
Thank you. And then, do you have any specific advice on diet during Ramadan that may help to increase the immune system of a fasting person?
So again, from a Western empirical evidence point of view, the advice is to have a healthy, balanced diet, and details of that are available on the NHS Choices website. There are some people are talking about vitamin C, for instance, and there is some weak evidence that may suggest that vitamin C at high doses in acute illness may be beneficial. Vitamin D deficiency is also being thought about as being a potential mediator of immunity, but again, that is unclear. And of course, people are talking about prophetic remedies such as black seed and honey, and certainly taking those in small amounts wouldn't be harmful, but their benefit is yet to be seen in, as I said, in a sort of Western empirical evidence perspective. But what I've advised is that people generally know what a healthy diet is, generally know when they're not being healthy. So if you want to get more resources, the NHS Choices website has some fantastic resources about how to maintain a healthy and balanced diet. And particularly in Ramadan, the most important thing is that people maintain adequate hydration. And starting that process from now, so cutting out caffeine, cutting out fizzy drinks, making sure that you get your body used to having a lot more water, are things that certainly people can do to start preparing for Ramadan in earnest.
Thank you. Someone has asked, how much of a risk is it if an elder person in their mid-80s is having COVID symptoms to take them to hospital?
So again, it's what does one mean by COVID symptoms? And this is where it has to be an individualized decision based on the person's medical history and the length of symptoms and the severity of symptoms. And I would advise in that case for that person to contact 111 or their GP and get a telephone or face-to-face assessment by a GP done. In that consultation, it can then be made clear as to how severe those symptoms are. People who are able to be managed at home, we will do absolutely everything to ensure that they can be managed at home. People who have to go to hospital, we will have that discussion with them about the appropriateness of going into hospital, given what we know about COVID and the fact that the elderly are unfortunately more likely to pass away from it if they are affected, and they are less likely to be offered ITU because of futility. So that conversation needs to be had. So rather than waiting for someone to become unwell and have that conversation, it's really important that families, as difficult as it is, to have that conversation in earnest while people are compos mentis. They have their faculties, they have capacity, and they're able to discuss their wishes. This may also include the option, and may Allah protect us all, if someone wanted to pass away in their own home, surrounded by their own loved ones. So these are all the sorts of things that people unfortunately need to be discussing, particularly with elderly relatives. But to come back to the question, to quantify that risk is very difficult to say. It depends on the performance status of the individual, as I said, on the medical conditions and what type of symptoms they're having, and what is the ceiling of care that is available in the community, and that has to be done on an individualized basis based on an assessment made by a qualified clinician.
Thank you. There have been a number of people who have been self-isolating for more than 21 days now and are not showing any symptoms. Is it safe for them to go out and volunteer with the number of community initiatives we've seen pop up now that they know that they don't have coronavirus?
So if you have been isolating and you're symptom-free, it's likely that you don't have coronavirus. But that doesn't mean you're not likely to pick it up and then pass it on to someone else, because the minute you walk out the door and shake someone's hand who has it, you've got it. And then for the next potentially 2 weeks, you could be spreading it around to someone else. So if people wish to volunteer, wish to work and are symptom-free and are healthy, absolutely, it's important that people do that, especially where there is a need for it. But it's important that adequate protection and adequate cautions continue to be taken. And people don't assume that just because I've been at home for 20 days or 21 days, I'm somehow not going to get coronavirus now. You could get coronavirus the minute you walk out the door, the minute you decide to pop over to visit your relatives. Unfortunately, we have actually been seeing a few people, a few cases of people doing that, thinking that, all right, we've all been camped together for 21 days, let us all meet and mix. And unfortunately, that's not how one stops the spread of a condition like this. So social distancing, self-isolation, very important. If you are going to enter into the workplace, whether that's through volunteering or through picking up a job as a key worker, it's very important that you continue to take precautions and you continue to take advice from your employers as to how to minimize risks and not bring them back home and spread the disease further.
Thank you. And then one final question. Has there been a genetic breakdown of the virus, and are Black and minority ethnic people more susceptible? And if so, do you think this is due to genetics or maybe social conditions?
So short answer is we don't know. There's lots of reasons that could explain what we're seeing. So the data that are coming out, these are audit data from A&E, from ITUs, excuse me, showing that BME communities are represented more than in non-COVID situations. And why is that happening? Lots of reasons, as you mentioned. Genetics could be a factor. We don't know. Could it be because London and the Midlands are one of the first areas to be hit in the UK, which have a greater proportion of BME people anyway? Possibly. Could it be because we know that BME communities, of which Muslims make up a third, are unfortunately more socioeconomically disadvantaged and therefore suffer more health inequalities as a result of those socioeconomic determinants? Possibly. There's lots of reasons as to why that is, and I think we have to be very cautious about making it out that we are somehow responsible for this, which is unfortunately what some of the narrative has been around. A lot more data needs to be done. Very few BME communities are part of clinical trials even before COVID. So it's really important that those people that are offered trials, if they are in hospitals, do consider taking them up because of these variations that we're seeing. And so, yeah, there's a big question mark over this as to why this is happening. We are seeing a similar sort of thing happen in New York and in Chicago amongst the BME communities there. So it doesn't seem to just be something that is unique to the UK or unique to Muslim communities, which may seem to give more credence to the fact that this is just an exacerbation of socioeconomic inequality. So people who can't afford to self-isolate and they have to work and therefore expose themselves to risk, or the fact that BME communities make up more of the patient contact, patient facing or public user facing industry and therefore placed more at risk, or the fact that BME communities may be marginalized in the workplace and not able to speak out because they don't have adequate protections. These things may seem to be more likely, but it's very difficult for anyone to make any causation based on the data that we're seeing.
Thank you. Thank you, Dr. Salman. There was a question about mental health support for Muslims during this time, and I just wanted to signpost to a number of organisations, Muslim organisations, who are working to provide mental health support during this pandemic. All of this information is available on the MCB website, where we can signpost you to these organisations, which is mcb.org.uk/coronavirus. But I will just name a few of these organisations who I would recommend getting in touch with, who might be able to help. There's the Muslim Youth Helpline, there is Inspirited Minds, there is BIMA, there is Mindworks UK, and there is Sukoon. So there are a number of organisations working within Muslim communities to provide mental health support.